So, good evening, and we are ready to start. So, I am Dr. Gauri I'm a trustee of the Brainchild Trust, and I work with children with disabilities. And today we are going to have our first session. So, this is going to be a two-part session, and today is the first part of knowing more about understanding more about attention deficit hyperactive disorder. And with no delays, let's welcome our speaker for today, Mrs. Jennifer Tavares. Hello, ma'am.
Good evening.
Good evening. So she is a highly versatile professional, I would say. So she has experience being a nurse, counselor, special educator, trainer, and a lecturer. So she's quite compassionate and she is very committed to what she's been doing so far. And throughout her career, she has been supporting and empowering individuals of all ages. So, parents, children, adults, teachers, adolescents. And we are lucky to have you here today to enlighten us also more about ADHD. And she is specialized in providing psychological counseling using CBT for adults, school age children, adolescents, where facing various challenges, and she is also conducts a lot of workshop on mental well-being, education, life skill building, resilience, learning disabilities, and ADHD, encompassing both children and adults. So with this, I'm sure we are also going to gain a lot of insight and knowledge into ADHD. I welcome you, ma'am, and over to you.
Thank you so much, Dr. Gauri, for inviting me for this session. And I'm looking forward to interacting with all those who are present over here. This is not a webinar, this is an interactive session. So if you all could switch on your videos, it would be very helpful so that we could interact with each other, at least over the activities. And then if you all don't have bandwidth, then we all can switch off your videos. So can we have a few videos on, please? As requested in the chat box, I have put all of you all can keep a rough piece of paper ready for an activity because understanding ADHD comes through activities and you all will be able to understand it better. So I can only see one video on. Can we have a few more videos on? Otherwise, we will not be able to do the first activity without that. In the meantime, could some of you all type in what your profession is? Either you have joined as a parent or you have joined as a special educator. You could put that in the chat box so I also am aware who is joining in. And can I have a few more videos on?
So when I was going through the registration link also, like you can see a varied things. So we have therapists, parents, school teachers,
Okay.
quite a variety who have joined. Even psychologists, they've all registered.
All right. Okay, so it's a mixed group. What I understand is, different from different professions. All right, if you all are not comfortable switching on your videos, I'll skip the first activity and I will go to the PPT and I will start from there. And
Maybe after a little while, if they warm up, we can try again.
Sure, sure. All right. If you all have questions, you all can put it in the chat box. After every few slides, I will be addressing those questions. Okay. So let's get started. Okay, so we are here to talk about ADHD, broadly to understand ADHD. I don't claim to be an expert on it, but I have dealt with many children, parents, and I've personally had a lot of interest in the subject. And therefore, I'm here to talk to you about those experiences and from what y'all can take home in understanding ADHD. If you are a parent or a teacher who's joining us, it would be very helpful for you because it's the first step to helping a child is to understand what you're trying to help the child about. Okay, so we'll get started. and we'll move into what is ADHD. And what I'm going to be speaking on this slide is mostly for screening a child and understanding them in what symptoms they bring to us. And then we refer them probably to the child psychiatrist for further diagnosis. So as you can see over here, ADHD is a neurological condition that affects a person's ability to pay attention. It is most common in school age children. Okay, we are seeing a lot of adults also being diagnosed with ADHD. I'll probably come to that in the next session. Today, I'm mostly talking about children who form the bulk of our, the diagnosis of ADHD and whom we get confused when we see such children. So what do we understand by a neurological condition is that it is a condition that impacts the brain and the nervous system, which means it's a lifelong condition once it is properly diagnosed. And therefore, we have to be very careful in observing the symptoms so that the child gets the right help based on his or her symptoms. So just to bring on some basic signs of ADHD, and you would be able to observe that in children 6 years and above. We say that till the age of 6 years, the diagnosis of ADHD by a child psychiatrist is usually not made. But sometimes children show a lot of, impulsivity, and therefore they might get diagnosed earlier. But let us look at it from a point of view from 6 years and above. The first type, that is inattention type 1. This is where a child zones out, does not, pay attention, usually is in their own world. We call them daydreamers and so on. And sometimes these children, this inattention gets picked up only when they reach class 5 or 6, when the curriculum starts to increase. And when that happens, the child is taken as, the parents are taken off guard, because till then the parents would have been attending the prize distribution day where their child would have been getting the best behaved child or the most quiet child in the class. And now suddenly they have been called to school to say a child was actually not paying attention in class. All right, so it's always good to see children who sit very quietly in the class, whether there are any learning gaps, in order to detect this type 1, which is called as type 1 ADHD. I'll be taking you all through a screener at the end, but right now, very briefly, I'm giving you some of the signs and symptoms. Then type 2 ADHD is where they only show hyperactivity and impulsivity. They are all over the place, they're very impulsive, they answer out of turn, and so on. And these children get picked up very early and very young, and they get referred faster and they get help also faster if the parent accepts that the child might get a diagnosis of ADHD. And if the child shows all these three symptoms, then they are diagnosed with type 3 ADHD. All right, so whenever your child is getting a diagnosis of ADHD, it's always good to know which category they are being diagnosed under, so that you are aware as a parent what help they would need. And we'll talk about the interventions part in part 2, which will come next month. All right, let's go to some of the causes and pathophysiology that leads us to understand ADHD better. I've tried to make it very simple. I know we have some doctors also in the group, but I'm just using simple words in order to reach the audience who may not understand some medical terminology. So when we look at causes and pathophysiology, the very first cause is genes and neurotransmitters. So when we talk to parents who, have a child who might be hyperactive or inattentive, what we do discover is that one parent would have had some issues at school. They would have been, pulled up by a teacher. The parent would have been called multiple times. The child would have had incomplete notes. And either the father or mother tell me, we went through all this, but see, we are successful today, right? But there's also a struggle that they talk about. So then we can safely say that maybe one parent had this, or an uncle, aunt also had this during their school days, but perhaps back then there was no knowledge of ADHD, and therefore a diagnosis was not made. So that's the genetic part. but and 50%, there's a 50% chance of offspring getting ADHD from either their mother or father or from any other relative. All right, so that's about the genes part. Coming to the neurotransmitters part. Neurotransmitters, as all of us know, they are chemical messengers that help transmit messages in the brain. And they basically transfer, allow conduction of nerves to, and they conduct messages to muscles or even to the other parts of the body. And so all of us, I mean, maybe some parents don't know, but we have 50 neurotransmitters functioning in the brain, and each of them know what time to act and what time to be, quiet. All right, and this just happens in the brain as we move along the day. However, in children with ADHD, there is a key neurotransmitter which is called as dopamine. And as you can see over here, dopamine is involved in several functions, including mood. That means, adjusting our mood. If I'm angry, I'll stay quiet. Working memory. Right now, all of you are using your working memory to listen to me, to take in all these sentences. Probably some questions are popping up. You'll write it down. All this is a part of what we call as working memory, which is very, very important for reading, for writing, for spelling, and for comprehension. Then we have attention. I've already spoken about attention, where you focus on what somebody's telling you or somebody's teaching you, and even decision making. So dopamine is helpful for all these key functions. It also helps one to regulate their emotional responses in order to take action. So but another important point is dopamine is also involved in feelings of pleasure and reward. And that is why you find a lot of children sitting with their phones and playing games, because it gives them this feedback and reward, and they feel very happy when they play it. Okay. So this is the first neurotransmitter is dopamine. There is one more lack of dopamine causes ADHD symptoms. It's not so much, there's a lot of discussion around this, whether it's lack of dopamine or whether dopamine is not getting transmitted in the way it should. And so different textbooks say different things. But just for all of us to understand that dopamine is required for all the functions that are mentioned on this slide. And sometimes child psychiatrists choose to give stimulant medications. In case your children are on Adderall, Concerta, or Ritalin, it is primarily because to help the brain not to reabsorb the dopamine, but to allow the dopamine to function. All right, so I hope I have made you all understand that. We have one more neurotransmitter, which is called as norepinephrine. Of course, when I was working as a nurse in the hospital, this was an injection that we used to give patients when their BP, fell. But when I came into special education and started reading up about ADHD, it says that it's also a neurotransmitter that plays a role in attention and thinking, and is a target for some ADHD medications. So some ADHD medications are given in order to play the role of norepinephrine in the brain. The imbalance is norepinephrine, and an imbalance in both may cause the ADHD symptoms like hyperactivity, impulsive behaviors, and trouble paying attentions. Doctors, usually child psychiatrists, would like to give non-stimulant ADHD medication for this category. I mean, this is just a broad way of understanding it. Doctor to doctor, they will see the symptoms and therefore they will decide. Now, sometimes when non-stimulant medicine is given, it takes longer to act as compared to stimulant medicines. And that is an important thing to understand if you're a parent and if you have been given non-stimulant medication, then you would need to have patience and wait to see that the symptoms get reduced. But what is the takeaway from these two slides? As a parent or as a teacher or as a special educator, you must report the symptoms correctly to the child psychiatrist. Only then can they decide what medication, what therapy, etc. is to be given. If we hide any of these symptoms, then the medication would not be helpful for the child. Okay, so this is just to give you some understanding of causes and its relationship to why some of the children medication is prescribed. Now, why are we talking about neurotransmitters? Because neurotransmitters do help us to pay attention for a long period of time. If you're able to pay attention over the next 1 hour or so, it means your neurotransmitters are functioning even at the end of the day. You would be more organized. You would find that, you have a structure to the day, a routine to the day, and so on. You would be more prompt and start your work on time. You don't procrastinate as much as ADHD children do. You would stick with routine assignments with less frustration. The key word here is less frustration. If a teacher is giving you instructions in the class, you're more likely to remember them and go back and tell your parents because your neurotransmitters were functioning well. Complying with instructions, and the last point here is able to recall information while working on longer problems and essays. Again, the key word here is working memory. If my working memory is functioning, only then I will be able to do all these higher order tasks and will be able to function in a way that is required for learning. Coming to the next slide is when you don't have enough of dopamine and norepinephrine, then you appear to not be listening. You remember the part where, I told you that the child zones out, does not listen in the class and so on. So appears not to be listening is a very important, feature of type 1 ADHD. They have difficulty initiating tasks like homework. Parents come and tell me to get them to start homework only is a nightmare. I'm just not able to get them to start. However, you've probably noticed that once you've got that engine running, you are able to finish quite a bit until they get tired again. They misplace items or forget what they were doing. So they are more likely to lose everything at school and come home. So you need to keep a stock of rubbers, pencils, books, because they might have lost that during the day. They would also forget to write down what their homework is, and they can't stay focused. And again, the key word over here is frustration. There's a lot of frustration because the brain is not allowing them to stay focused. They are very irritable and easily argumentative. And sometimes you might wonder, what did I say? I just said one word and the child is, very irritated and jumping up to argue. They have difficulty holding information in their mind, again, working memory, and they have more difficulty recalling information that they have just learned. So you might have taught them something, but then they are unable to remember it after a period of time. Are there any questions? Okay. So I'll continue with the causes. The second cause, the first cause were genes and neurotransmitters. The second cause is frontolimbic dysfunction. All right, the frontal means the prefrontal cortex, which is this part of the brain. And the limbic system includes the hypothalamus and the amygdala, which regulates our emotions. Okay, so Satterfield and Dawson were the first to propose that ADHD symptoms were caused by frontolimbic dysfunction. That means messages are not going as they should be. And they also suggested that a weak frontal cortical inhibitory control over limbic functions could lead to ADHD. What they're saying is that this the impulse control, just to simplify this entire word, which is here, it means impulse control is lacking in these children. Now, how is the prefrontal cortex involved in ADHD? There were MRI scans done that showed that the right prefrontal cortex is smaller and less active in people with ADHD. And that's the area where the attention center is. Weaker connectivity. That means the fibers which join the different parts of the brain are very disorganized in children with ADHD. And the last part is slower maturation. That means some children, their prefrontal cortex may get developed later than the age. It may not be age appropriate, and you will find them very immature as compared to the other students. Coming to some other causes, which is mentioned over here, is the decreased metabolic activity in areas of the brain. Now, what does this mean? It simply means that the brain uses less glucose in the prefrontal cortex, and that is why the brain, this part of the brain, is inactive. All right, and there are times when you'll suddenly find this child is able to do so much. Probably at that point of time, the glucose is getting, being allowed into that part of the brain, and therefore the child is more active. Okay, so keep in mind that, as I already mentioned earlier, medication, if it is given, is used to mimic the action of the two neurotransmitters in order to help normal brain activity, or as close to normal brain activity, for children who are diagnosed with ADHD. There are a few other factors which I would like you all to be aware of, is that sometimes the mother may have had pregnancy, a difficult pregnancy and complications during the delivery. Some literature says that probably these children could have ADHD. If passive smoking, that means the mother was exposed to passive smoking, then maternal alcohol consumption. There is a lot of articles written on food additives. Some articles say food additives don't contribute to ADHD, and there are an equal number of articles that say food additives contribute to ADHD. So there is a dilemma there. However, giving a child healthy food stays the norm. Increase screen time. Increased screen time. What happens when a child is exposed to the screen time all the time, playing games or watching something on the screen for a long period of time? It gives them a dopamine rush, and that leads to them showing ADHD type symptoms, and therefore the diagnosis might be wrongly made. And therefore, we must talk to parents about screen time before sending them for a diagnosis. Lack of play, and this is something that I keep telling parents, that every time a child moves, every time a child moves their hand, there are 10,000 neural connections being formed in the brain. Ditto if they kick a ball, jump up and down, but play, unstructured play, is very, very important for the normal brain development to happen. And lastly, and perhaps most important, and I should not miss it out, is that anxiety can mimic ADHD. A person who is anxious will show all symptoms of ADHD type 2 or even type 1. And a child who has undergone trauma like death of a loved one, a parent, or has been beaten up a lot, comes from institutions, where care is not being provided, neglect, and the parent has not, been taking care of the child emotionally, physically, and so on. This can also show up like ADHD. And therefore, a detailed history of the child is very important to know what is happening in their house, or the history of what the child has gone through, to the day you are going to send the child for a diagnosis. Okay, so these are all the causes, and the purpose of starting the workshop with the causes is to tell each of you it's not the child's fault. Right? We put the child through assessments, we put the child through all kinds of therapy, and sometimes we make the child believe that you've done something wrong, and that's why there is all these problems in your life. But because it's a neurological condition, the child has no control over it. But we can teach the child certain things to help them cope with these symptoms and how to reduce them. Any questions so far? No, nothing?
As the session is going, you can put them in the chat box also, and when she pauses, you can unmute yourselves and ask.
Right. So any questions till now? Anybody wants to unmute and ask? Okay, I'll continue. You can put your question in the chat box. Don't worry. You can put it directly to me or to Dr. Gauri if you want to stay anonymous. That's also fine. All right. So we'll continue with the session. But the next one, I would like you to do a simulation with me. I hope you are all there. Otherwise, can't see anybody's videos on, but anyway, I'm going to play out. Not going to play out. I'm going to show you something in the next screen, and you will have to do that activity with me, so that only then you will understand what a child with ADHD goes through. So the request I'm making is that imagine, there's no competition. Dr. Gauri doesn't have any prizes over here. We don't want you all to win this. What we want you to do is to step into the shoes of a child who has all the three symptoms: inattention, hyperactivity, and impulsivity. And with that in your mind, try to do this particular exercise. All right. So it's a simulation. The purpose of it is to help you understand what the child goes through. I'm not testing your knowledge or your capability of doing the activity, which is on the next slide. I'm going to ask all of you to turn up your speakers, make it loud. Okay, are you all ready? Yes? Okay. So there is a passage that I've put out on the next screen, and I'm going to ask all of you all to read that passage, and then I'm going to ask you to answer some questions which are given based on that passage. So it's like a reading comprehension exercise. All right, but you will get exactly 1 minute to finish reading and to answer the questions. And you will have to tell me after that how many questions you were able to answer. Shall we go? Yes? Okay. Don't forget, imagine you are having all the three symptoms. The article is put up, so you can start doing it now.
Unit heading up to the code 3 chase. Suspect was last reported southbound on Highway 99.
Can you give me more info on that call? Just clearing another call.
Unit heading up to the code 3 chase.
Closing fast on the vehicle that matches the description.
On Highway 99.
The reported party? Can you give me more info on that call? Just clearing another call. Stand by.
To the code 3 chase.
Try to get in front of this.
Suspect was heading up to the code 3 chase. Southbound on Highway 99. Reported southbound on Highway 99.
Just clearing another call. I'm headed over there. Just closing fast on the vehicle that matches the description. Closing fast on the vehicle that matches the description.
Southbound on Highway 99.
Can you give me more info on that call?
Southbound
Just
on
clearing
Highway
another call.
99.
I'm headed over there. Closing fast on the vehicle that matches the description. I'm headed over there. The reported party? All units go to condition
on Highway 99. Unit heading up to the code 3 chase. Suspect was last reported southbound on Highway 99. Highway 99.
Can you give me more info on that call? Just clearing another call. I'm headed over there. I'm headed over there. Closing fast on the vehicle that matches the description. The reported party? All units go to condition. Piled into a rig. Stand by.
Okay, so how did you all do? Could you all hear that sound as well? I want some
Yes, ma'am.
responses. I don't think you're going to switch on your videos. So do put your responses in the chat box at least. Let us know what happened. How was that? Were you all able to answer everything?
No, ma'am.
No.
No? Okay.
No.
Were you
I
able
don't
to
think I
read the
reached the
passage?
questions either.
I couldn't even like finish first 4 lines. It was so difficult. I had to
read.
go back to read
All right. What made it
Yeah.
difficult, Shalin?
because they were continuously speaking and it was not one, like there were like a lot of noise, so it kept distracting.
All right. So there was not one noise. There was a lot of noise. All right. That's
And
Shalin.
also, I was going back to the question and coming back, like I wanted to cover it up, but I couldn't.
Okay. Anybody else wants to share? Thanks for that, Shalin. Anybody else wants to share?
I
What-
was not able to concentrate for reading at least.
Okay, Aduri is speaking. Am I right?
Yes.
Okay, you were not able to concentrate. What happened?
Like the voice was disturbing more.
Okay, the voice was disturbing more, but you could have stayed focused on the words. But you
Instead
could.
of words, I was trying to focus on the voice actually.
All right. So you got distracted or you got focused with the voice. All right. Thank you for that.
Ma'am,
Okay, we have one more.
Even
ma'am, this is Aparna here, ma'am.
Yes.
It was so irritating. I just felt like putting that on mute. I
All
couldn't.
right. Okay.
stay focused at all.
Yes.
Okay.
Similar kind of feedback from the YouTube viewers as well.
Right.
We can't answer a lot of noise, irritation, mood fluctuations.
Oh, I see. So much happened in a minute, right? Okay, so thanks for that, Aparna and Dr. Gauri. I mean, whoever's on YouTube, thank you for that. Joshal's hand is
I
up. You
think,
like to
yeah,
answer? Yeah, go ahead, Joshal.
Yeah, so what happened is usually when like we audios like that is played, we kind of get alert, right? That was the first instinct that came up. So even those symptoms that you said, like if an ADHD child would probably hear it, they would get panicked, like what is the police, speaking on the hockey talkie, and then it gets harder to even read the passage. The passage was something very like in a very calm, like talking about treasure island, and it was hard to get back and answer and keep our body like very like our mood regulated while also listening to something really panicky on the audio.
All right. Okay. Um, Thanks for that, Joshal. I don't know whether you're Alicia or Joshal, but thank you for that.
Social, yes. Yeah.
Thank you. We'll take one more. Manju, your hand is up, and then we go to the next slide.
Yeah, I actually tried to focus on reading,
Okay.
but I could not understand or remember after what I read. So I have to go back again to the first sentence, recollect it, then again I was in the first four sentences only again and again. That's what I felt.
All right.
And I was trying to relate when I read the first sentence, I was trying to relate to the question, but I couldn't find the answer. So made me confused.
Okay. And Manju, you're a teacher, parent.
A teacher, ma'am.
All right. So now in a classroom, don't mind me asking you, this is just
Yeah, no problem, ma'am.
We give the students not just one paragraph. We would have given them
Many.
and the treasure island might be a longer. I just took one paragraph.
True.
There,
True.
right? And
True.
so how do you think those children in the classroom, whether with or without ADHD, but experienced what you just told me, how do you think they would feeling?
All the children, ma'am?
No, some of the children. As you said, you reached the first.
Yeah, they may feel confused, and I have seen few children like trying to read again and again what is in the board.
Right.
And they will see the board, they will see the book, they will try to follow, but it's sometimes when we give more, it becomes difficult to follow the lines.
Okay, so
and few children will come and ask us, ma'am, is this correct? After this is this, and where is full stop? And they're very particular. Children who are very particular in writing, they will be coming and asking questions again and again.
Okay, so thank you for that. You said confusion, and you remember in the previous slides, I kept underlining the word frustration. So a lot of times confusion leads to frustration. Now, Aparna said she wanted to mute it. I don't know whether she did, but I'm wondering how many of you actually muted it and read and did that. Well, because that's maybe you all were able to think and do it. As I told you, it was a simulation. And sometimes, I mean, I don't know, Aparna, you could tell me, did you really want to give up on that activity, what was put out there?
Actually, I did, ma'am.
You did.
In
Okay.
fact, it probably, I mean, thinking from a student's point of view, probably it also adds on to the, an anxiety to perform. Will I be able to perform with so much disturbance around me?
Absolutely.
That's the kind of feeling I got.
Very important that anxiety could come in such children. And, you said you gave up. So very often the children in the class are giving up because they could not focus. Okay, so thank you all for participating. I'm just going to take you all back to the next slide. Are there any questions? I can see something in the chat box. Actually losing the track of the story. I left reading after some time. I was not able to focus. Okay, you're asking to repeat the impact of glucose level in ADHD. That's the previous slide. I'll come back to that, Aparna. If I forget, just remind me. I just want to complete this activity. The purpose of the activity was to help you all understand what a child goes through if he or she has got ADHD. All right, now none of you are, I mean, maybe some of you have, but still you all experienced that and you all were able to understand. So did you all get the answers right? How many of you all, I think Manju said she just reached question number 1. But did anyone get the answers right? Perhaps not, but anyway, that was not the reason for putting out that activity. But let us say that before I did this activity, Dr. Gauri announced that those of you who get all the answers right, you will get a cash prize of 5,000 rupees each. What would all of you all have done? You all would have used strategies to start refocusing. All right, the key word in ADHD is that they can't refocus. All of us get distracted. But for ADHD children, the problem is they can't refocus. Okay. Now, some of them get distracted by visual distractors and some of them by auditory distractors. And that's why I had both on the screen. Okay. Now, imagine a school, a big school where there is, sports day practice happening, some road traffic. Bangalore has a lot of traffic on the, everywhere. Imagine a child with ADHD sitting in a classroom with so many distractors. When I was much younger, I would wear hanging earrings, I would wear bangles, everything. But once I started working with children with ADHD, I stopped doing all that because even that would visually distract the child. And to get these children to refocus and get back on track, I might as well not wear any of these extra things. Okay, so remember that everything that's happening in the classroom, a child's pencil box has fallen down, the focus goes there and then they can't refocus. So as I said, children with ADHD find it hard to refocus. They lack organizational skills. As teachers, one look into their school bag will give you a diagnosis. Okay? Those who don't have ADHD will pack their bag properly. Everything will be neat. We won't have, bits of paper and everything in the bag. But that's just one tip that I'm giving you. They are the most misunderstood children in the class. They are called because it's an invisible disability. You can't see it. Like a child with cerebral palsy, you can see it. A child with autism, to a large extent, you can see it. But children with dyslexia and ADHD, it's an invisible disability. You can't see it. So they're always labeled as naughty, distracted. Everyone wants them out of the class in order to complete curriculum. I do understand that. And therefore, they remain the most misunderstood children in the class. Keep in mind, the ADHD symptoms should be pervasive. That means if a child is hyperactive in the class, they should be hyperactive on the playground, hyperactive when they go to church, hyperactive at a wedding. It should be everywhere. It should not just in one place. Otherwise, there's somebody being very strict with the child that the symptoms are showing up in another place. And so that's another very important part of understanding ADHD. And of course, I've spoken a lot about dopamine, so I won't repeat that. I'm just going to go back to Aparna's question on glucose, which came in the slide which spoke about the biological contributors, that is the decreased metabolic activity. What it means is that the brain, that is the prefrontal cortex, uses less glucose, and that is why the brain stays inactive. All the food we eat gets converted into glucose and goes to different parts of our body, which gives us the energy to function. So if there's a less amount of glucose going to the brain, that's why the child would appear dull and down and unable to study, and they won't even know why. All right, so Aparna, hope I have answered that.
Thank you, ma'am. Yes.
Okay, so we move on. There is a screener which I have on the next page, and I would like all of you all to use the screening tool. I will share it with Dr. Gauri, and she can. Okay, there's a question over here. I'll just take that before going into the screening. Are there specific causes related to specific parts of ADHD? Could you unmute and ask this? Like, are there specific causes? Yeah. So if it is more with the prefrontal cortex, the delay and the immaturity of the prefrontal cortex, then we see that hyperactivity and impulsivity is higher. Okay, so it's all about the development of this part, the brain which comes in this part of the, over here. Have I answered you, Lizzie? Thank you. Okay, so this is a SWAN rating scale, which is used as a screening tool. Okay, so this is what I do. If I have a parent who comes and reports symptoms to me, I would collect a detail right from birth till now. Then I would also sit with the child for some time and ask them, what their day is like, what they eat. I would collect information about, what they're learning in the class. I might do a little bit of screening in terms of how much they can read, their addition, subtraction, and so on. All that will be done. And then I would give this sheet to the parents, that I would say, tell the mother to fill it up separately, the father to fill it up separately. And I would say, if it is possible, give it to the teacher. Sometimes parents don't want to give it to the teacher, which is fine. And then they will have to, it's called the SWAN rating scale because it's adapted from James M. Swanson, which is mentioned over here. And that is why it's called as a SWAN screening tool. So there are 18 items, which mostly are the symptoms of inattention. The first 9 are the symptoms of inattention, and from 10 to 18 are the symptoms of type 2. Okay, so if you go through it, all of you could take a moment and just randomly give a score to it, and then I will tell you what to do. Okay, you don't think that I'm going to say this is your score. Just think of some child or think of yourself and just give yourself a score, and then I'll tell you how to do the scoring. I'll give you a minute for that, so that you will be able to give yourself a score. So you can just write 1, and if it's not at all, just a little, quite a bit, very much, write that down. Whatever it is, not at all, write it there. Have you all finished? Okay, I'm assuming that you all have finished, and this is how you have to do the scoring. Okay, so if you have tick marked over here or over here, give yourself 1 point for that. And if you have sticked yourself here or over here, then give yourself 0 for that. And you can add up all your score, and you could roughly, any of you could put your score there, that the total score you can put. If anyone is comfortable doing that, you can just put your total score just for discussion purpose in the chat box. Okay, so somebody has put 4. All right. So now if the total score is 4, okay, let us say that's the total score. Now what it says, you're supposed to write it over here, but that's if you're going to submit this document somewhere, you could be very organized, but otherwise you could just add it up the way I've told you. Now, if the total for items from number 1 to 9 is 6 or greater, okay? So let's say for all these items, you've got a score of 6 or more, then it is likely that the child has got type 1 ADHD. If you take this particular score and the child has got 6 plus in this from items 10 to 18, then it's likely that the child has got type 2 ADHD. And if they have scored high in both, that means they have got a combined type, which is called as type C or type 3 ADHD. All right, so that is how the scoring is done. Then we refer on the basis of this, we will refer the child to a child psychiatrist for a diagnosis. The diagnosis is not to get them medication, it is to clarify and to rule out other conditions like anxiety or anything else, which I will talk about in the final slide. Do you all have any doubts about this, about what I just said, about the scoring? If a child is in place where there is no noise, then can we say that the child having ADHD will be able to focus perfectly? Just to tell you that I created this situation, all right? But even if you put the child in a soundproof room, okay, there could be visual distractors. Even when you all choose the textbooks for a child, some textbooks have got too many pictures, and the child focuses more on the pictures than on the written content, I mean on the typed content. So we can't say for sure that just putting the child in a noise-free room, they would be able to focus perfectly. It could be that maybe that also we have to review whether the child has ADHD or not. Okay, or
Again,
having a good day in that sense. Okay,
it is their mental clutter also, right?
It's
So
a
that is
chaotic
what
mind.
you simulated is going on in their mind, the flow of thoughts and things. So outside, if you kind of dampen it also inside their mind, this is all still going on.
Right, you're very right. Okay, and just to add to what Dr. Gauri has said, if they are type 2 type, where they are hyperactive and impulsive, we usually see after the age of 13, 14 years, we usually see that physical restlessness stops and the mental restlessness takes over. And then we think, oh my God, my child is cured, he's fine. But in truth, the child is still having a lot of chaotic thoughts, etc., in the mind, which may not be taken care of. And then what happens is we find that these children tend to go into addictions because they want that relief from the mental restlessness. Okay, so we have to be very alert about these things when we say, or we put them in a quiet place. No, just by not wearing these earrings and bangles, it didn't mean that they didn't get distracted. I just try to reduce the distractions and we try to work from there. Any doubts with the scoring part? This particular 1 to 9, the score is 2, 10 to 18 is 7. That means it is type 2, the person who's put it, Lizzie. That means you must have just done it randomly. It shows that the child could probably be at risk for type 2 ADHD. And then Suma has said 1 to 9, the score is 8. I don't know what the score is for 10 to 18, Suma, but if it's 1 to 9, that means the child is at risk for type 1 ADHD. Okay, so I hope all of you have got this. Dr. Gauri, there'll be a way to send this out to them.
Yes, we have the registered participants' email IDs. We can share it.
Okay, I'll share it with you and then you could send it. And it's very simple. And then we look at the scores of mother and father also, and we look at it together. And then we also know who is spending more time with the child, and we give more importance to that assessment, rating than the other. Okay, any questions on this before I move to the next slide?
Ma'am,
Yeah.
Should it be given for the teacher and also parent, or while we do the assessment, is it only with the parent and the observation psychologist can do it, ma'am? How is it?
I give it only to the parents and I tell them if you're comfortable, give it to your teacher also. Give it to the child's teacher. See, if you all are clinical psychologists, you all will be using different tools. I'm aware of that. This is just a tool for those of us who are not trained on the clinical psychologist tools. Okay, but this will help you if the teacher also gives their inputs. But some parents are reluctant to give this to the teachers. That's why I said at least take it from the parents.
Thank you.
You're welcome. All right. Any other questions? Okay, I'll go to the next slide now. Let me just remove all this annotation from here. Yeah. Okay, I have one more exercise for you, one more activity for you. And I want all of you now to find the black dot. Okay, I'm going to put a picture over there and you're going to get 30 seconds according to my timer. And you have to unmute and tell me on which line, that is first, second, third line, you are seeing the black dot. All right, are you all ready? Okay. You'll have to find the black dot. That's the target. All right. Your time starts now. No answers yet?
Ma'am, black dot is written no, with the spellings.
Ah, you found that black dot, but I want you to find it from the picture.
It is moving as you look at it.
It is moving. Dr. Gauri says it's moving. Can others help her to find it?
There's
Very
no
quiet.
definite
Everybody's very
black
quiet.
dot.
Sorry?
There's no definite black dot.
Yeah,
I
it
think
keeps
black box.
shifting.
Feels like an
It's
optical
saying
illusion.
no black dot and it's moving is what you are saying. Yes.
Zero black dot.
All right. Let me, if there's no black dot is what you're saying, but you did see some black dot, no, Vanilla?
Yes. No, ma'am. Zero black dot is it.
Sorry, you can't see a black dot at all?
There
No,
are many
ma'am.
black dots
Moving, it
which
is
are
looking
moving.
like in all white, it is like black dots only. When we are moving the eyes, it is looking like
Okay,
that.
when you move your eyes, you can see it, otherwise it looks white. Okay. See, the point that I'm trying to make through this. Okay, this is called as the Herman grid illusion. So it's an illusion to, you won't see the black dot. It will be there, but it will move around as you all have described it. But the idea is that we keep telling ADHD children to focus, but for them, it's all over the place. You are telling them focus here, but they can focus here. And then suddenly they can focus here, but you are still telling them, please focus here. And that is what leads to a lot of shutting down behaviors in children with ADHD, where we find the maximum number of school dropouts are children with ADHD because they can't cope up with the system. Correct? So remember, the key takeaway from this picture is that don't worry if you couldn't find it. Even ADHD children won't be able to find it. But focusing on something that you are telling them to do is hard. It's not like they're trying to play up, but it's very, very hard for them to focus, to refocus. And I told you all the reasons it's not the child's fault. And usually they get help very late. And therefore, in the process of helping them, we understand that it is hard. Then we'll also simplify that content that we are giving them so that it's not like finding the black dot over here. All right. Okay, so thank you for your answers. And just to close today's session, we'll go to what is your role. We will look at interventions in the next session, but just to complete today, and maybe some of you may not be able to join the next session. What would be your role? And these points which I've put down are more from an advocacy point of view than the intervention part. Firstly, whenever the child gets a diagnosis of ADHD, whoever you might be, teacher, doctor, special educator, whoever, It is to empathize with the child and the family, and especially with mothers. And why do I say that? I'm not dismissing the dads from the equation, but somehow mothers take this diagnosis very, very personally, and they think that they have done something wrong, and they focus on that rather than focusing on getting help for the child. Okay, you might have also seen the other side where the parent is not bothered, but that's a different population. Remember that getting a diagnosis and being told that there's something wrong with the child, every mother will first go into denial. Okay, so give them that space to come out of it, show them the checklist, show them, there are ways to help your child and so on, and give them about 6 weeks to come out of that denial phase. Use checklists to determine their learning styles, especially if you are teachers. Determine, are they visual learners, are they auditory learners, and help them to learn accordingly. Be proactive to guide them to experts for assessments and guidance. You all know that, Dr. Gauri and team, even the team at Aster, they all do these assessments. Then we also have Nimans, Spastics Society, St. John's. All these are places where assessments can be done. Create awareness in your circles about learning disabilities, ADHD, and other special needs. We don't have so many voices to speak up for these children. And so as adults, we have to be that voice for them till they are able to fend for themselves. When children with mental health issues are brought to you for whatever reason, don't forget to check for ADHD or learning disabilities, because one could lead to the other. All right, so just to sum up this particular picture over here, a child with ADHD could have depression, could have anxiety, could have autism, learning disabilities, other mood disorders, or conduct disorders, or oppositional defined disorders, because they can't regulate. Okay, the key thing to understand is they can't regulate their emotions, and they could have tic disorders. Tic disorders are involuntary movements of the various muscles, which comes up for them as a coping. And we see more children with ADHD having this particular disorder, it could be associated with anxiety as well. So these are some comorbid disorders that they could have. ADHD could present with some of these disorders, or it could present by itself. Okay, so just for you all to be alert that not to miss out on any of these, comorbidities in case the child comes to you. And don't forget to advocate for such children. They need us more than ever, because the educational system is hard, and but there is a lot of help available, which we will talk about in the next session. Yeah, any questions you have now, we could take those questions, and then we could wind up, because otherwise it would be a long session. So I thought we'd wind up.
I think, Miss Lizzie, I think you had put a query on YouTube also, right? Do you want to unmute and ask your query?
Who's that?
Miss Lizzie Verma.
Hello?
Yeah.
Hello. Yes, Shreyla. Go on.
So I was asking if there is any particular tool to assess what kind of stimulation is stimulating for them. Is it visual distraction or auditory kind of a thing? Is there any specific tool that can be used?
Unfortunately not that I'm aware of, but it is that we just assume that a child with ADHD can get distracted with either. All right, or a key teacher or a parent who's observing the child will be able to pick up by observation what distracts this child most. In fact, what we see is as they go to the higher classes, somehow the noise, they learn to cope with noise at school, and they actually function better with the chaos around them. And some of us special educators also will agree with me that we also get used to that chaos, and we also learn to function along with them. Okay, so I wouldn't say there's any definite answer. Dr. Gauri, you want to say something?
Yes, so we cannot always definitely say which aspect is affecting them a lot, but in some children, they could have an added on what we say sensory processing difficulty. So again, there is a query here on YouTube also by Rajeshwari Ramesh. I have noticed my son closing both his ears sometimes 3 to 4 times a day. So these things are affecting these children. So it could be auditory, too much of visual processing as well. So we call this as sensory processing difficulties. So that is, it is too much to the extent that they cannot just tolerate. So they tend to avoid these things, or sometimes even they can be seekers. So sensory issues can also be there in these children, which can add on. And this is more in younger than the older ones, because they tend to kind of regulate or build up some form of coping mechanism to kind of avoid these as well. But these difficulties can affect their learning. And there is what we say sensory integration therapy done by occupational therapists, which can help these children cope better. So I think we will deal with that. So if it is too much, just seek out and talk to some therapist, and or come see specialist who can kind of analyze these things in more detail. Because there's a very fine line where you say this is this or this is that. So when Miss Jennifer was talking about, it could be anxiety, it could be there are other differentials. So sometimes we may take a little time to observe and help out and kind of follow up and see even before we make diagnosis as well.
Thank you, Dr. Gauri. I think Vinita has got a hand up. You are going to ask something?
Yeah, yes, ma'am. I just wanted to ask about the SWAN assessment, the screening list which you shared, as you said that we have to give to both the parents and the teacher also could be. So how will we compile then? I mean, how will we interpret the results?
Interpretation is, as we told you, that the interpretation is only for you to get a sense whether whether the child is showing these symptoms. Why the parent will come and the parent will say, all kinds of things to us. But to make it more specific, that is why we are giving
Kind of look at it in the way it should and then give feedback so that they are giving constructive feedback rather than giving complaints about their child.
Yeah.
Vinita, first half of your question, I'm not sure if I heard right, but have
Yeah,
I answered?
actually, ma'am, I think I have a connection problem.
Yeah. Okay,
Am I audible, ma'am? Am I audible now?
I can hear you.
So I just wanted to know because we are giving the same questionnaire to the three people. I mean,
Yeah,
both the parent and the teacher. So
right.
now, how will we consolidate it? How will we compile everything and find out the final thing?
So
I mean, how will
this
we?
is only a screening tool. We don't consolidate this scores, but when we use other tools like Vineyard and other corners and so on, in that case, it's all consolidated. But for this, it is to give. See, sometimes, to be very honest, when we have parents sitting in front of us, the dad will be saying the mother is making this up,
Exactly, yeah.
right? And the mother will be saying the dad is making it up. It could be any which way, or grandmother, or whoever. Now, the idea of putting this in front of them is that if there's a very wide discrepancy, it could be that the dad is not spending that much time with the child if his scores are lower than the child.
Okay, okay,
Okay,
okay.
but we don't want to miss, we want everyone to participate in this. So that is the reason. Sometimes dads don't fill up. Then we go with what one parent is saying, or vice versa. Okay, but the whole thing is that we are getting them to, because as I told you, we need their help for for identifying the symptoms. We can't do it without them. It can't just be going and telling the doctor, my teacher said the child is hyperactive in the class and maybe having ADHD. It can't happen like that. So it's not so much to consolidate, but it is to help them to think, does my child have those symptoms or not?
Okay, okay, okay. Thank you, ma'am. And one more thing,
Again,
ma'am.
it
Do
is
you have?
about the fine line. If you see the questions and how you're marking it, whether to see the impact of those symptoms. So,
Yeah.
is it happening all the time, or it is very less? If it is very less once in a while, even for us, we would have that now and then. So, to know where exactly the problem areas is, knowing the impact will give us a better idea. So, that can also be taken into consideration.
Oh, okay. Thank you, ma'am. And one more thing, ma'am. Do you have any screening tool or any assessment for the learning styles? As you said, Even I feel that that is very important to find out their learning style, so we can
I will
help
share
them.
it with Dr. Gauri, and she will email it to you along with that. It's to detect whether the child is a visual learner or auditory learner. But remember, with ADHD children, you might not see consistency in types of learning.
Multisensory we have
Yeah, a
to.
multisensory, or on that day the child is learning better in a particular way, go with that. If you're a parent, I understand if you're a teacher, dealing with a class might be difficult, but if you're a teacher, multisensory learning works best.
Okay, ma'am. And this this tool we can use for any age group.
Up to the age of 18, up to the age of
18.
18, yeah.
Okay, okay. Thank you so much, ma'am.
You're welcome.
Ma'am, I have two questions.
Yeah.
So the first one is it possible for a kid with ADHD to not have sensory processing issues? Because I have seen my kid has kind of type 2, it's too early to make a diagnosis, but he has kind of type 2 ADHD, and I have seen him working on things, focusing on things that he likes, and then most of the general distractors,
Mhm.
they
Okay.
don't bother him then.
Okay. So Lizzie, the first part of your question, and maybe Dr. Gauri can also come in. This is a neurological disorder. So the nervous system means the five senses, right? So it is somewhere the sensory processing can happen for some children. In some children with ADHD, it's very mild. For some, it is, very evident that we have both. All right. And that is why we say send them for a detailed assessment so that we don't miss out on anything per se. Okay, so it's not like it has to be there, but very often children, because it's a neurological disorder, we see sensory processing issues are there.
And ma'am, I have one more question. Sorry to interrupt. Uh, the second question that I have is the metabolism actually related to hyperactivity as well? Because my son has like he has a high metabolism. So the thing is, I feel like this is also connected to his hyperactivity. And in case that correlation is there, then what can be done? Because there is not much that we can do at metabolic level, right? So, is there a correlation?
How
First of
old is
all,
your son? How old is your son?
he's going to be 5 soon.
Yeah. See, it's very early, I think, for diagnosing metabolism and so on. Just give him high calorie foods, and that's the age where they want to run around and do lots of things. But in terms of diagnosing and doing something about it, Dr. Gauri and team might be better placed to answer that.
Okay. So when Ms. Jennifer was talking about prefrontal cortex, right, where
Yes.
the limbic system, the pathways, they're all developing. So all these things start to develop only from 3 years onwards. So when you actually see any children younger than that, they are all over the place. As soon as they learn to move, they want to go explore, not sit in the place. So we are all kind of running around these children, but only as they grow older is when they start able to kind of sit for longer, attention span increases, they're not running around, they start to understand. So this kind of development happens over time. That is the reason even for diagnosing ADHD, there's we say only after 6 or 7 we are really considering, because before that even their brain, the pathways are still maturing, it's still developing. So that is why when especially these terms are used for 3 to 4 year olds very loosely, it becomes a problem. So that may not be the only reason. We have to look at the child as a whole. And with diet, it has to be a wholesome diet, especially for children at that age. And the other things, what Miss Jennifer has already pointed out, the amount of screen time, and are they getting that free space to play physical activity? If that is not given, because children need physical activity because they have that much energy in them, and that is how they're learning through play. So if that is not given, if they are having too much screen time, that itself adds on to them mimicking like they're too hyperactive. So there are a lot of factors to consider, and at that age they're still growing, they need nutrition, but in what form you're giving, because everything is needed in moderation. So in what form you're giving, it is important. So if it is too much sugary fried foods, all that too much what easy sugars like juices or chocolates or sweets, or in that form the sugar level rises. When the sugar level rises instantly, then that can cause hyperactivity as well. So diet wise, that is I think the only thing we would say, to restrict everything in moderation. I think that is what I would say. So at that age, we still need to look at the child before saying what exactly the problem could be.
Okay, doctor, because the first indication that we got was at home, but then the teacher confirmed that even in school environment, compared to his peers, he is running all the time. He is not sitting even for the things that require him to sit in one place. That's why they pushed us towards getting the ADHD support,
Yeah.
which because the score so far for us in the 10 to 18 question was 7. So that's the reason they are saying. So what I'm trying to understand here is it a phase where we wait and see, or is it a phase where we can do something proactively?
Yeah.
So
Liz,
that it can help them because neural pathways are still
yeah.
forming.
Yeah.
But once it is done,
Lizzie, please attend next month's session. We will tell you what to do to enable or to enhance the sitting tolerance. We must not miss out that there are certain activities that we have to sit with the child, like do board games and so on. And this checklist, which I have shared with you, the SWANS checklist, is for a child who is 6 years and above. Okay? Because we expect children to be moving around. You can go back and tell the teacher that this is what we have said. But a child who is at danger, impulsive, all right, let's say darting across the street, touching something hot, and so on, then those children we would like to see them first. All right, all other children who are very playful and hyperactive and all till the age of 6, we say no, no diagnosis. I'm sure Dr. Gauri, all child psychiatrists will say the same thing. Okay, but do attend our next month session and you will get more answers. But till then, I would encourage you to allow free structured play as well as play some board games with your child, all of you, in order to get that, turn taking, sitting tolerance, and all other things that come. It can be very harrowing when a teacher keeps calling us. That's why I said we mothers take it very, very hard. But there is a lot of help that you can do with your child and increase that sitting tolerance. Okay?
Yeah, but the point you mentioned, we can start early, the brain is still growing, is very valid. There are things where, with activities and things, when we do the next session, they will cover more in detail. So that is there. And the other thing, what I've noticed is even in LKG, UKG, the amount of things that is expected from a child has increased tremendously. So the amount of writing, reading, what they need to learn. So each child is different. Some learn it more quickly, some are better in sitting, some are more playful. So we can't really categorize at this age.
Yeah. Any other questions? Thank you, Lizzie. Thank you for asking. We understand the concern. We'll definitely take it up in the next session. Somebody is asking a question how to connect for the next session. I guess you'll be using the same email addresses, no, ma'am? To send them?
So I have put up our WhatsApp channel QR code. If you join over there, we'll keep posting as and when we'll be every month there'll be a session on different topics happening. So you can be updated there. I'll just post the Telegram group code as well.
Any other questions before we wind up?
So,
Ma'am, this is Aparna here. I just like to ask Ms. Jennifer this question. Uh, I've noticed that some of the children who have ADHD and who are our students, they have a tendency to fidget or move their hands and legs when probably in a class. Okay, so is it okay to let them continue doing that? Because I find them um, focusing more. I mean, I don't. So is it okay to do that, or do you, the natural tendency is to correct them? Say focus, keep your
Right.
legs, sit properly,
Correct.
don't move around.
Right.
So
Yes.
how do you deal with a situation like that?
The more we tell them to do that, we are not helping them to regulate, and some of these things should be ignored. Now, if I might say, 98% of you all in this workshop chose to switch off your videos. Some of you might be lying down, some of you may be relaxed, but we tell little children you should sit straight, you should not move, you should not fidget. For the nervous system to regain its, regain that attention, the child has to move. A child's body is wired to for movement. It is not wired to sit in one place. But as Dr. Gauri said, we have increased syllabus, so therefore these children are struggling to sit. So it is okay for them to fidget as long as they are not disturbing the other person, like punching the other person or something like that. But it does help them to regain that focus. Little bit of blood movement always helps all of us, and I would say that it should be part allowed by the teachers at least till they go into class 8, 9, 10. Okay, Aparna, I don't know where you went, but I hope I've answered.
Yes, I'm here, ma'am. Thank you. And ma'am, also most of there are some children who come with both autism and ADHD, right? Or they might show signs of
Right.
ADHD also.
Yeah.
And there are some who have this habit, like for because of sensory issues, they might hit themselves near their ear or their heads, right?
Mm.
Um, so again, the first impression that a person would have is, why is he hurting himself?
Mm.
So again, do you correct that or do you let it be? Because it might harm the child. He
Mhm.
might, hurt himself. So out of concern, you might try
Yeah.
to stop. But then, is it okay to let them do that?
See, it depends. That if you don't allow them to do it, then sometimes it moves into the sticks and other things, other problems for the child. But I would say that if a child if it's a soothing behavior for the child, then we let it be. Like sometimes stimming and all that, we allow them to do that. But if the child is harming themselves, like scratching or doing something very harmful, then we have to teach them an alternative strategy to soothe themselves.
Okay. All right. Thank you, ma'am.
Anybody else? Dr. Gauri, there is a message saying they're not able to join the group.
Anyway, I think whoever is registered this time will send out a email as well. Okay, so that we will do. And again, they could be using these things to regulate themselves as well. So these behaviors, and we call what we call sensory breaks. I'm sure that will be covered next time. So all these are okay as long as it's not affecting anybody else in any way.
Sure, ma'am. Thank you.
And there was a question from the people who have registered, how to differentiate true and false ADHD diagnosis.
Okay, how to, yeah, I would say just to answer that, I think it's got answered already that we use the screening tool, and if we see them at risk, then we refer them to the child psychiatrist. But we have to keep in mind the history taking. Have they suffered any trauma? Have they lost a loved one recently? And that's why the symptoms are they on their screens for n number of hours, because that could show the symptoms in the school. All right, so therefore, a detailed history collection, not just that screening tool, and sending all of that to the next person that you're going to, the child psychiatrist or the developmental pediatrician to take forward. Then only we will be able to make the true diagnosis can be made. Yeah. Any other questions, Dr. Gauri?
No, I think we've covered
Okay.
most of them.
All right.
I will just try and copy paste the link also for the WhatsApp channel in
Okay.
case the QR code didn't work. So I've just done this. But anyway, whoever registered for today's session, we will email all of you with the next session details as well.
Yeah.
Okay.
Okay. Thank you, Dr. Gauri. Thank you for having me for the session. And thank you to all of you for joining in. Yeah.
So, on behalf of everybody, I would take this opportunity to take you, Ms. Jennifer Tavares. Thank you so much for accepting our invitation and doing this. And this is quite a complex thing, very kind of commonly used terminology. So, explaining it in so much detail and with the simulations, I think it has given us a better idea about how what is going on. So we look forward to having you next month as well to continue the session. And thank you everybody for joining us today. We'll see you all again. Thank you everybody. We'll close the session now.
Thank you. Bye.
Bye.